In July, we brought together ecosystem players around 5 collaborative actions. It was amazing having so many socially impactful and diverse people and teams from all around the world meeting in person at the retreat. Everyone agrees that collaboration is required, yet everyone is busy with their own priorities and it doesn't always flow so easily. Our insight is to identify the sweet spot between each party's strategic ambitions and actively foster collaboration based on shared and collective value.
My name is Hilmi Quraishi. I am an Ashoka Fellow and I became a fellow long time back in 2008. I am based in India. I run a social enterprise by the name ZMQ, which works on healthcare, providing last mile health connectivity to the communities. We work in India, we work in Afghanistan, and we work in 5 countries in East Africa, and now planning to grow into West Africa, Francophone African countries. The Collaborative Action Lab was really very exciting in the terms that I really echo with what Bill Drayton from Ashoka says, teams of teams. So it is an opportunity to have a collaboration, and it is, and for us it is a larger collaboration because it's not only between ZMQ and Ashoka and Philips Foundation and Philips India, but we have another large international non-profit, Save the Children.
Before coming here, it was always thought that probably it's going to be a prime and a subcontract sort of an arrangement. And as a technology partner, he will develop the technology, give it to us, and we will just go ahead and implement it. But after talking to him, a completely new perspective which came up was that his involvement in the project is not going to be just for the part of developing the technology, but also to make sure that we co-create the process, make it happen at the field level, make adjustments and iterations on the way through, depending on what the community needs, and finally making sure that we achieve the result that we are looking for. So this is completely new and was quite an insightful thing for us.
We have kind of bonded at a certain level because now we understand each other, we have met face to face, it's easier to go back and connect.
Actually, the collaborative action process has been quite a revelation for me as a person and also for the organization that I'm representing.
With Ashoka, Philips Foundation are aiming for systemic impact in healthcare access. Nobody can do this alone.
ZMQ has a large program on tuberculosis, which we are running for the last 5 years in India. It has now got adopted by the Ministry of Health in India and also got adopted by the Ministry of Health in Uganda. So here, our role ends up here as an agency which is going to set up a model, and now this model has been adopted by the governments. So again, similarly, we feel that in the sector of child pneumonia, which has the potential to scale in larger areas. So here we are working on the behavior change model, and with Save the Children, we are working on the case management.
It's not about me, it's about we.